This video is a demonstration of clinical palpation to the elbow region, lateral and medial elbow. For palpation, same as other region, we have the hypothesis in our mind first, then to differentiate whether this is golfer elbow, tennis elbow, or other condition before we do the palpation and confirm. Here I want to emphasize that for lateral elbow pain, lateral epicondylitis, no matter which naming, a lot of people have confusion between the traumatic type and the overuse type. The overuse type of typical tennis elbow is the repetitive use of forearm extensor. So getting the overuse of lateral epicondyle, the common extensor muscle. So the pain and tenderness is around the proximal muscle, the tendon, and the muscle belly. However, according to the clinical experience, this type of very typical lateral epicondylitis is not that common. The more common is rather than the traumatic type. The traumatic type is after the elbow twisting or any sprain injury causing the ligamentum injury on the lateral collateral ligament on the elbow joint or around the superior radial head area. The difference between two is that one is the tenderness along the muscle. Then in this type is a true tennis elbow. We need to do the loading adjustment, soft tissue treatment, and then to stretch it as a soft tissue treatment. For traumatic type, if the ligament injury very sharp localized tenderness here and the people feel decrease in muscle strength and then with a history of sudden onset, it's very important to do initial protection and immobilization. The treatment approach, of these two are totally opposite, so better to find out. And also, a lot of people, especially post-fracture, they will miss that the forearm supination pronation beside the distal wrist region, then proximal forearm also contribute to supination pronation we can do some joint play movement on the radial head here to see any stiffness restriction during supination pronation. Then this is the lateral elbow. Going to the medial elbow is rather straightforward. Number one is exactly the same as the lateral elbow. We need to differentiate whether it's true golfer elbow, the pain, the tenderness is along the proximal part of the common flexor muscle, or it's a traumatic type, is the ulnar medial collateral ligament. In here, one more palpation you need to find out, you never miss that. Between the medial epicondyle of the elbow and the ulnar or lacunar process, you can easily find the cubital tunnel here. The ulnar nerve you can find it here easily. Then if any suspension on the entrapment of this nerve, you can do the tapping test. If it reproduces a symptom, it is a typical Tinero sign, or you can see any tenderness discomfort here. This is the elbow palpation.